And so today's session is titled Healthy Habits and Behaviors to Keep You Well, keeping in mind that we are returning back to campus. Many of us are, some of us aren't, but these are all tips, tricks, strategies that you can use to protect yourself, whether you're on campus or off. And I want to go ahead and introduce our guest speaker for today. So I have the pleasure of introducing our wonderful director down at Student Health, Dr. Julie Casani, and she's got quite the bio that I could read off, but sometimes I think it's better if we give shorten it. Yeah, I was gonna say I had a very long one, and I was like, what can I say? What can I say? So without further ado, I think I'll just go ahead and turn it over to Dr. Casani. Let her give her introduction because I'm sure she can say it better than I can say it, and also highlight some of the things that she's most excited about when it comes to the work that she does. And we have that shared tide of having a master's of public health. So I feel very, very excited to have her on the call. And without further ado, I'll turn it over to Dr. Casani.
So good, I guess it's good afternoon, right? Oh my gosh. These days just kind of like, they all run together and you never really know what time of day it is. Hang on one second. When I wear my mask, my nose runs and I sneeze. I don't know why. All right. And I'm a doctor, I should. So anyway, hi everybody. I'm really happy to be here, and I've already started sharing my slides. So hopefully you can see them. Alexis, is it working?
Yes, we can see your slides.
Good, okay, great. So yeah, so I'm a physician, and I practiced emergency medicine for several years at Hopkins, and Hopkins in Baltimore, and then got my master's in public health for a totally different reason. But had always been doing disaster preparedness work and actually bioterrorism work. Started in 2000 as the bioterrorism coordinator for the state of Maryland, which in October of 2001 became a big deal. Before that, nobody really knew, including me, what my job was supposed to be. And then with anthrax in the United States, got pretty busy. And that role morphed into a director of public health preparedness for a state health department. That's what I did in Maryland. Saw the light, moved to North Carolina, did the same job for the state here from 2006 until 2017. In the meantime, I had gotten introduced to NC State from a variety of different ways, and I was teaching here, and when the position here at Student Health opened up, it was an opportunity for me to go back to patient care, continue doing teaching. I teach global public health, and continue to do some management and be involved. Little did I know that in January I would return to my public health disaster preparedness role and help manage COVID here on campus. So, I keep changing careers, thinking I'm leaving one behind, and that's never the case. So I don't advise a lot of students. It's probably a good thing. I actually do, but only about global health. So anyway, so here I am. Excuse me. So Alexis reaches out to me and says, hey, would you mind doing this power lunch on healthy habits? I don't even know if you gave me the title initially. And I'm like, running through 100 emails, and I'm like, yeah, sure, okay, another staff meeting. I'm happy to talk to them. And then yesterday, as I'm preparing for today, and she was doing a great job. She reminds me to get my slides in. I'm like, yeah. It's at 12:30 on Wednesday. They'll be done at 12:29. And I read her email, and I'm like, wait a minute. And then Shannon texts me, and she says, you all ready for tomorrow? And I'm like, wait a minute. So I find out that this is the power lunch and not a staff meeting. So, but I did just finish my slide. So hopefully this will help answer some of the questions. So the title for today's talk is Healthy Habits and Behaviors to Keep You Well. And so I'm sitting there thinking, well, what am I going to talk about? So yeah, that's not what the title is. So what we're going to talk about today is COVID-19 on campus, and hopefully give you some key points for you to, make you feel better about what your actions are, what campus is doing to help keep you safe, and, how to cope with some of this stuff, because it's pretty crazy. I worked from 2000 to 2017, so 17 years on preparing for a major pandemic. always in the back of my mind, never thinking we'd actually have one. So, and I've talked to very good friends of mine who are also in the business and said, did you ever really think we'd get here? And none of us ever believed that this would happen. Lots of plans in place, but we, it's like, you're planning for it, and you don't think it's ever going to happen. So I can tell you that this has taken everybody by storm. Maybe not surprised, but by storm. And people are doing what we can. This is a new virus. We've never seen this virus before. So we had no idea in January what it would do. We thought we had some clues, but we have other coronaviruses, but this one's a little bit different. This isn't exactly the flu, but it's an awful lot like the flu. And suddenly people were getting really sick and we didn't really know what was going on. So it's been very crazy for everybody. And that just raises your anxiety, right? I mean, if knowing you have a pandemic and this overwhelming infection is scary, knowing it could affect you is scary. But then when people, including me, who theoretically is an expert in this, saying to you, I don't really know, is probably even more scary. And so I get it. All right, I get it. And so hopefully we can give you some idea on how to corral that. I think the thing that makes people, humans, the most scared about something is that feeling of loss of control. So maybe I can give you some hints about how we're trying to get control on this, and maybe that'll help bring you to a place that's better. Okay, so enough philosophizing. Let's move on. All right, so here we are. Back to campus. When you do disasters and emergency medicine, you have to have a sense of humor. That's one way of coping, right? All right. So now we're back to campus. All the students are back, and this is the way I feel all the time. I actually feel more like this in the grocery store than I do on campus, but that's the point. So I'm going to take this from what I think are the big questions that you might have and try to address them head on. I'm not going to get into a lot of nerdy science, although I can, but don't tempt me. So how safe is campus? I mean, I think people really want to know, how safe are we? And I literally walk around every day and say, well, how safe are you at the grocery store? Or how safe are you just walking in your neighborhood? So I want to compare and contrast what it's like on campus as opposed to some of these other public places we go. And I have to tell you, listen to me, I'm tired. The New York is coming through. I have to tell you that I am more nervous in a grocery store than I am on campus. Here's why. When you go to the grocery store, it's all about, you, right? You wear your mask, you stay 6 feet apart or try to. You're careful about what you touch, and you either wash the cart when you go in the store or wash your hands or use hand sanitizer. And so you're doing all of those great good old-fashioned public health infection control things that you would do normally. And then you have this cart, which is a mandatory 6 feet away, because all you have to do is bump people with your cart to get them to move away from you. And you feel like you create this little cone of safety around you, right? But if you've been to the grocery store lately, and I went to one on Saturday, and after 15 minutes was ready to just scream and get out of there, you realize that you really do have to depend on everybody else's humanity, right? And everybody else's self-responsibility about what they're doing. And when we're in our native land, like a grocery store, it's really hard to do. And people don't do it as well. I traveled 2 weeks ago to bring my son to graduate school in New Orleans, which is a big hotspot, or was a big hotspot 2 weeks ago. And I have to tell you that we didn't pass in New Orleans a single person who didn't have a mask on. As people were walking down the street, people stopped, moved to the side, and got out of people's way. Every restaurant we went into, they took a person's name and telephone number so they could do contact tracing. So there was a lot of obvious control measures going on. But I think it's because we were all travelers there. So we were out of our native areas. We were all nervous about traveling, and so we paid extra attention. And then I went to the grocery store Saturday, where everybody is a native of our little area, and nobody was paying attention. People did have masks on, that's good. But other than that, you know, it was a lot more difficult. So what's it like being back on campus? Well, I think right now is prime opportunity to instill those behaviors and make those behavior changes that we want, right? Public health is all about behavior changes. So let's do those behavior changes. So as you can see from the picture on the left, and this is a real picture, students are wearing masks. I walked around campus yesterday and the day before, and there were very, very few people who didn't have masks on, who should have had masks on. Now, obviously, if they're sitting, eating, they're not going to have a mask on, but had masks on. They've, by and large, were trying to stay distanced apart, okay? Sometimes it's just not that easy. I didn't see as many people stopping and moving out to the side or to the street while they were walking, but I did see people trying to stay distanced apart. Excuse me. I don't know yet about hand washing. I'm going to have to observe because you know I do as a public health person, but I think people are trying to do that. We had a problem the first day that students were back on campus. Student health, as you know, is right across the street from Harris Field. There were a lot of students out there playing in Harris Field, playing volleyball and sitting around and not wearing masks and being very close together. We went out and started talking to them. And we said, you know, if we have to shut down again and you have to go home and go back and live with your parents, the reason is because you're not wearing a mask. And they all took their masks out. And now every day when we peek out the windows, we see that they're wearing their masks. So I think that campus is, you know, people's behaviors are fairly safe right now. Do we have outliers that aren't? Sure, we're going to have outliers. But I think by and large, if we can continue to instill the behavior in everybody, we can do the right thing and keep the campus safe. When that behavior, and I'm talking about students, we tend to focus on the students' behavior because for whatever reason, we have the least trust in them. But I have to tell you, when I say that there were very few people who weren't wearing masks, the people who weren't wearing masks were not students, unless we have a much older student population than I thought. The people I saw that didn't have masks on were, I would call them adults. They were either parents visiting, but I think they were staff members. And so I have to say that the people I'm most nervous about are people who think that they're making decisions on their own and are independent and are not wearing masks. So I really want to encourage people to take a good look at yourself and your own behaviors and wear masks. And if someone near you is not wearing a mask, say, you know, I would feel more comfortable if you had a mask on. I talk to the staff that way. Sometimes I'm in my office and I have my mask on, the staff comes in and I say, would you mind if I don't wear a mask or do you want me to put it on? And we have a couple people who say, I'm 6 feet away from you, but I want you to put your mask on. And I do. So I think that humanity, that kindness, that reminder is going to go far. So how safe is campus? I know somebody raised their hand, Alexis, so.
Yep, I was just chatting them back and saying when we get to a good spot, if you want to unmute yourself, you can chat with Dr. Casani. So young student workers are not keeping track of where their hands are. Help guide 2 yesterday that were, oh, okay. Yep, so we got it. So yeah, not sure how to keep track of where their hands have been and what that contamination might be like.
Yeah, and so I think that again, we can be kind and remind people about that. I am terrible. I have a lot of behaviors and habits where I'm scratching my eyes, I'm touching my glasses, and so I do a lot of facial touch, and I've had to learn not to do that. And I've had staff remind me, I've had friends remind me, you know, you're touching your face a lot, and I'm like, I forgot. And so I have to relearn those behaviors. And I think, again, in a kind way, if you feel comfortable, you can remind people of that. So I do think that that's possible. Let me talk about a couple of programs that we've put into place to try to help control coronavirus on campus. One of the questions I didn't put up that's really common is, do we have it on campus? The answer to that is yes. we are part of North Carolina. We are part of Raleigh, and the community transmission rates. Here I go. The community transmission rates are, they're elevated, and so we're going to have coronavirus on campus without a doubt. We can't put ourselves in a sanitary bubble. So how do we control it when we do have it on campus? That's the real question. Well, aside from the behavioral things I've just talked about, there are programs that we can put in place, that we have put in place to try to get a handle on it. The first one, and this is the one that we probably, I would say this is the one that we rely on the heaviest, and that is contact tracing. So the way this works is that if a person, a student, staff member, faculty member, is either told that they have COVID, has tested positive, or knows, and we just added this piece, or knows that they're a close contact, they can go in and self-report. They give their name, they give a contact information. If a person self-reports, they should expect an email, so you have to watch your email. If you don't respond to the email, we will track you down and we'll try to call you. We get that information as well. But you go ahead and self-report. What then happens within 24 hours, we've actually been doing it on average between 8 and 12 hours, we reach back out to that person, and then we start talking about, so when did you get diagnosed? And let's say it's yesterday. Good. So we're going to go back 2 days before yesterday, and you start telling me everywhere you've been and who you've been in close contact. And that close contact is defined as closer than 6 feet for longer than 15 minutes. So that's where it goes back to that grocery store. As you're walking up and down the aisle in the grocery store, you're going to pass people. That is not a close contact. A close contact is you being for longer than 15 minutes with that person, because it takes that long to get enough virus into you. So there is a time period to that, and also within that 6 feet, which is why we like to 4 to 6 feet, which is why we like to stay away from each other. So that's the distance of the grocery cart, right? So we go back 2 days and we say, where have you been? Who have you been in close contact with? And what you know, give me their contact information. And then we reach out to those contacts and we say to those contacts, hi, Alexis, I'm Dr. Casani calling from Student Health, and I heard that, or I'm under the impression that you might have been in contact with someone who has coronavirus. So are you okay with that? Let's talk about that. Let's talk about what that means. And then we go through that close contact with her. At no point do I tell Alexis it was Shannon Dupree. Okay, I never bring up Shannon's name. Okay, if Alexis puts 2 and 2 together, okay. If Shannon called Alexis and said, hey, Alexis, you're going to be getting a call, I just want to warn you, that's Shannon's business because it's her medical information. But we won't share that information with Alexis. So it's done confidentially. We don't rat anybody out. And then we go ahead and we tell Shannon, who's the case, poor Shannon, I made her sick. Shannon, who's the case, she needs to isolate. She probably knows that already, for 10 days. And then we tell Alexis, because you're a close contact, we need to quarantine you for 2 incubation periods, which is 14 days. And what that means is that for 14 days, Alexis is going to stay away from other people. Now, if she lives with other people, she's already done what she's done with them and has communicated that illness or not to them. So they're all going to quarantine together. But she's not going to work, physically to work, and she's not going to the grocery store, and she's not going to go pal around with her friends for those 14 days. So that's quarantine. The person who's sick has the isolation, and that's basically the same thing. We also asked, the biggest, closest contact things are things like eating, sitting on the couch, watching movies together, and using the bathrooms together. So we make sure that Alexis has someplace she can eat pretty much by herself and a bathroom in her home that she can use by herself. So that's what quarantine is. So we do that, and then we track. And I'll say, Alexis, every day, you're going to get a questionnaire to fill out for us about symptoms. And should Alexis develop symptoms, remember she's the contact, then we'll say, okay, Alexis, why don't you come on in and get tested? We do that for NC State students, faculty, and staff. All right, so everybody. If we identify somebody else who is not an NC State contact person, you know, they're not an employee, they're not a student here, we actually share those names with the county health department and they do the contact tracing with them. So we work on NC State. So this program is in place. There's a link on this. You'll get these slides. There's a link on this, or you can go to Protect the Pack website and sign up there. Now I'm going to stop for a second because I see the chat like boom, boom, boom. So let's stop for a second.
Yeah, so let's see. In the chat, we've got a couple of things, and I'm going to scroll back up to where I saw understand virons, but have other questions regarding certain work scenarios. I think that's what we're saying, Marn. And then as we continue to scroll down, we're definitely gonna take the chat, the things that are added into the chat, and store them in the notes for when I send out the follow-up following the session, along with the slides, the recording, all of that good stuff. Kimberly says, why can't you work remotely if you test positive for COVID?
Right. And so, Alexis, also, if we get questions that we don't address here, I can put answers in and when you send them out. So that'll be good too. So you can work remotely, and you can also, that's why I said quarantine, she can't come to work, but she can work remotely. So you can do that as long as you're feeling well enough to do that remotely for sure. So a lot of the students that we're putting in quarantine will continue to be able to take their classes if their classes are offered virtually. And that's one of the things that was requested of instructors, to provide that kind of instruction. So good.
And I've got another private question that came to me. So when Dr. Casani talks about 15 minutes of contact, does that mean walking or running past someone you would be safe? Or is it, i.e. just going on a walk with someone on a trail? Is that safe?
So being outside is a bit safer because the sun and the wind help disperse and kill the virus. But even so, we would still consider, if you were 15 minutes walking with someone, we would still probably consider you a close contact.
Okay.
There's a couple of questions in here about routine surveillance.
Mm-hmm.
So, you know, surveillance, and I'm going to talk about a different surveillance program in a second, but surveillance is done on asymptomatic individuals, people who don't have symptoms. And there are some universities and some work locations that do daily questionnaires and temperature checks and testing. I'm going to talk about a surveillance program that we're doing with testing, but let me talk about daily questionnaires first. We decided not to do daily questionnaires because we realized that we would have 46,000 or so, because 36,000 students and about 10,000 employees, 46,000 questionnaires to look at. Because I am a very strong believer that you don't collect data if you're not going to look at it.
Yeah.
Otherwise, there's no reason to collect it. So we realized that we would have 46,000 pieces of data a day to look at. First of all, that's a lot of data. And second of all, we're not really sure what we would do with that data. So what we do instead is to say, you know, every day before you come to work, stop for a second and say, are you sick? Are you not feeling well? Did you have a fever? And if the answers to any of those questions are yes, stay home. We are not in a high-risk situation like a hospital where, you know, it's very likely you'll have been impacted and exposed to coronavirus. So doing that kind of questionnaire routinely and mandatory is, there's a different sense of priority to that. So we decided not to do those mandatory questionnaires. Can you do it yourself? Absolutely. And in fact, on several of our websites, it's actually recommended that you stop every morning and say, am I feeling okay today? Temperature checks. Temperature checks are not valid. They don't provide valid data. I'm not going to say they're not valid. They don't provide valid data, and here's why. 80% of people who went to a VA facility, Veterans Affairs facility, who had the diagnosis of COVID had either tested positive or even were going to be admitted to the hospital because of it. 80% of them did not have a fever. So that tells you that you can have the infection without having a fever. And then I'm going to ask you, for those of you who have been on campus, when you walked from your car today, when it's, what, 89 degrees outside, you walked from your car in North Carolina on a hot, humid day into the building, and as you walked into that building, we were going to scan your forehead for a fever. What do you think it would show? it would show that you had a fever because that's how those temperature things work. But you probably didn't. You were just probably outside in North Carolina on a hot August day. And so again, we get a lot of false positives and we get a lot of false negatives. And so that's why we decided against temperature checks. And then the third one was, why didn't we test everybody? Because, first of all, it takes a couple of days for the test to come back. I had this conversation with a parent who was moving down from New York. And she was moving her student in on last Friday. They were leaving New York on Wednesday in order to be able to drive down here at a leisurely pace. Had she left on Wednesday with the test result in her hand, she would have had to have gotten that test on at least Monday, if not Sunday or Saturday before. So a whole week before arriving in the residence hall. In that week, they were traveling 600 miles and stopping in 3 or 4 states, right, for gas, get some food. And there's no guarantee that in those 6 or 7 days that they weren't then newly exposed. So having a negative test from a week ago isn't going to help. And we did not have the facility here at NC State to test 46,000 people within a day or two of arriving on campus. So that's why we didn't do it. So let me tell you about our surveillance program, because I think I'm going to be answering some of the questions in the chat. Is that okay, Alexis? Can I?
Yep, absolutely. We'll
okay.
hang on to the other questions and answer them as we can.
Yeah, good. Okay. And I might answer some of them. So we, knowing that we couldn't test all 46,000 people in 2 days, and trust me, we did the model because this is what I used to do, was build these kinds of models. We decided to take a sample of the population here on campus and to test them regularly throughout the semester. And so we're going to be implementing the Wolfpack surveillance program. What this will do is it will test on a regular basis asymptomatic volunteers. So it's a voluntary program, and people sign up. There's 3 groups of people, cohorts that we're looking at. One is students, one is staff, and one is faculty. And we will test half of each of these groups 1 week. They'll have their off week where they're getting their results, and then they'll come back the next week. In the meantime, on that off week for cohort A, we'll be testing cohort B, right, the second group. So every week we'll be testing half of each of these cohorts, but every person will come every other week. Participants agree to come every other week for the duration of the program. So we don't really want people to come once and then skip out. We want them to come back because we want to get a good measure. This is a sample. We want to get a good measure of what's happening on campus. And we have criteria within those groups to make sure we have a broad picture. So for students, it's on and off campus housing. It's different colleges, different, whether they're graduate or undergraduate students. For staff, we have a couple of roles that we're kind of focusing in on. So out of the staff, we'll make sure we get some dining servers. We'll get some IT desk support people. Housekeeping is in there. And then the general staff. And also people, both staff and faculty, people who have risks for serious illness like age over 60 and underlying medical conditions. For faculty, they have to be teaching longer than more than 20 hours per week on average. So there's a lot of different things and aspects we're looking within each of these groups. It's free. The testing is free, and you'll get your results confidentially. So we'll do it. It's handled through our medical record, so people will get their results through Healthy Pack portal, and we don't release anybody's name. So if Alexis turns up positive, for Alexis, I keep picking on her, if she turns up positive, I'm not going to go tell everybody, oh, did you know Alexis is positive? That's her medical information. I'm not violating that confidentiality. But if 6 or 7 people, including Alexis, are positive, of course, the university wants to know what the status is. And so in aggregate, without identifiers, that number is passed up, and also within those classifications. So the overall data is passed up to university leadership. Unfortunately, the timing of this webinar, the deadline to sign up is today because we need to make selections because we want to start testing on Monday. And this is the link. It's really easy. It's a Go NC State, and it's a Wolfpack-surveillance-program. So we'll get that moving. All right, so that's the surveillance program. We also continue to do testing in student health. I think I talk about that in a minute. So let me just get to the next slide. And I do see some of the questions, but I'll keep moving through and then we'll get to questions. Okay. All right. So I came up with a couple of other hot topics, and one of them is, where can I get tested if I'm sick or a close contact? Well, student health will test, of course, students who are sick and are close contacts. They make an appointment. If you work with students, please remind them that they have to call for an appointment. They cannot go online nor walk in. We're not seeing what we want to be able to control our waiting room a little bit and make sure that sick people, come in, get seen right away, and other people aren't lingering around. Our pharmacy still is open though, so please tell students that. Unfortunately, we don't see staff or faculty or employees here in student health, but if you're in the contact tracing program, we do offer testing if you're in the contact tracing program. So if Alexis was identified as a contact and she 5 days into it, because we need a little bit of time for that test to be accurate and valid, I talked to her and she said, I'm really nervous about this. I know I have to be in quarantine for 14 days, but I have a little child at home, I'm making it up, and I'm really worried about them. Can I come in and get tested? She can come in and get tested. So if you're in the contact tracing program as an employee, you can get tested. We've also done some cluster testing that we had a group of employees on campus who work very closely together, and a couple of them got sick, and so we did test everybody as close contacts. So, but unfortunately as employees, you can't come to student health just to get tested. Students can't come in just to get tested. They have to either be a close contact or be sick. The reason for that, well, not employees, but for students, the reason is that students can't just walk in and say, hey, I want a test, is because their insurance will not cover it. Your insurance as an employee won't cover it either, and that's $115 out of your pocket. So that's why we don't do it. Face coverings, what works best? Well, you may have heard about that other institution up the road that did that big study that made a lot of news, Duke. And actually they showed that gaiters are not effective and may actually help to transmit the virus, as the same with knit fabric. That also potentially allows for more virus to get out. But plain old homemade face coverings like this work really well at keeping that virus and basically your exhaled air, which is moist and damp, from getting out. So you might have seen what I did. So I take my mask on and off all day, so I use my little NC State lanyard to hold it, and so I'm always have my mask handy around my neck. So face coverings, that seems to be what works best. They work, and I will put a link in what I send you, Alexis, for a little video that shows just how good they really work. I will warn you that it's meant to appeal to younger people, and there's some language in there that may offend some people, but I'll send you the link anyway, because it is really a cute and very well done video. All right, how will I know if someone is positive? This is a question I answer 1 million times a day. So as I said, if I find out that Shannon is positive, Shannon Dupree is positive, and I talk to Alexis, I can't tell her that Shannon is positive. So we're not going to tell office mates that somebody is positive. If they're identified as a close contact, we will reach out to them. We will do the best we can, and we talk to people. We interview them. Where have you been? Well, how close were you? And we err on the side of caution to be sure that we connect with as many people as we can. We have interviewed many, many more people than contacts, okay? So which is a good indicator of how broad we cast that net and how many people we actually do talk to. But we are prohibited from releasing that information. And so I can't tell people, hey, did you know that somebody blah, 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 blah was positive? So I ask that you trust us, that we will get to the people, the right people, and let them know. Now, if Shannon wants to tell people, be my guest. It's her information. It's her medical information. She's welcome to share that. But if Alexis says, I heard somebody was positive, I got that call, and Shannon's been out sick, so it must be her, well, that's gossip. And I think we need to be kind and not do that kind of stuff. So I know it could potentially be scary, but if everybody, if we do our job right, which I make sure people do their jobs right, people wear their masks and wash their hands, that contact is not going to be impactful. Okay, so it's what we call a casual contact. It's walking past that person in the grocery store. The other big question I get is, when will the campus shut down? Like, what's the threshold? How many people does it take for the campus to shut down? And the honest answer is, we don't have an exact number, because it depends. It depends, is it, all of the safety personnel that's out, in which case the campus isn't safe, so we need to be worried. Is it one whole residence hall? So do we need to shut down that residence hall? Is it one department faculty? Is it one office staff? So we have ideas, but there isn't a clear, definable number. I frequently answer this question by saying, we'll know it when we get there, or when we're approaching it. I really do believe that. I worked for 17 years trying to define this threshold, and we've never been able to do it. We'll know it when we get there. It's kind of like good music and good food. You know it when you've had it, but if you had to define what it was beforehand, you wouldn't be able to do that. So I know we'll know when we're getting close, so that we can take the right actions, and there's multiple steps before that, but we don't have an exact number. So there's that. So I want to get to the questions, some of the questions in the chat, but I do want to say that, this has been a heck of a year, okay? It's pretty amazing how much we've been through already. I mean, gosh, we even had an earthquake, right? Who would have known? Who would have thunk? So this has been a heck of a year. On campus, I put my syllabus together for my class, and I sat back and thought, how are these students going to do this for 15 straight no-break weeks? And my class is easy, okay? I mean, there's a lot of work, but it's a neat class. It's a fun class. It's not organic chemistry or physics, okay? But there's no break for projects. There's no, breaks for going home and seeing family. Many of the students can't go home and see their family because of illnesses. So this is going to be a tough time. And my consolation in this, the thing that I think is going to get me through this, is that we're all in it together. And so I know I can call someone up and say, today's just a really lousy day. Let's go have, with our masks sitting 6 feet apart, let's go have a cup of coffee. And knowing that we're all going through it together, I think will help us. And knowing that at times, I'm going to have a panic attack in a grocery store. And I'm going to just need to drop everything and get out. And I'm going to go sit in my car, catch my breath, and say, yep, it got to you there. So I think knowing that will happen, knowing I have resources, I have friends, there's resources as employees that we can use, will help us get through some of this, because, the virus is there, but it's our mental behavioral health that's going to really take its toll on all of us. So let's get to the chats. Wow.
Yeah, so we've got quite a bit, and I'll go back to where I kind of left off with Claudia. So on a I guess a little more positive note, in a way of managing mental health, we've got some runners, some athletes out there. Do you need to keep more than 6 feet distance from them compared to normal conversational people, and do they expel further than someone just talking?
So someone's been reading. Yes, actually, it was a runner scientist who determined that running and any kind of strenuous activity, you actually, of course, expel more air. The best visual example I saw of this was a picture of the Green Bay Packers playing football, and how you see that cloud of breathing, right, on a very, very cold day, how you see that cloud of exhaled air. And so when you're exerting yourself, you evaporate more and you breathe more deeply, you breathe heavier, you breathe more deeply. And so you're more likely to expel virus. And the slipstream is increased. So I actually advise people who are exerting themselves to increase that from 6 feet to about 10 feet. So let me stop sharing that. So yes, it makes me very nervous. You know, my office is beautiful. Let me show you my view real quick. I look back out onto the parking lot of Student Health, and that's the greenway in the back. And so I get to see all the cross-country teams running every day. I'm very jealous that they, first of all, can run, and second of all, that they can run, and then at how thin they are because they do run. But they're always packed up, you know, and that makes me very nervous. They should be distanced apart. So I would suggest I also travel down Hillsborough Street in the morning, and I see the spin cycle class in the morning, and those spin cycles are like at least 6 feet apart. That's good. So yeah, you need to be a bit more distanced.
So let's see. We have a little bit of a scenario, in particular when we're talking about those work scenarios. And Maren says the specific concern is sufficient disposable resources for close-in work that cannot be done with just one person alone. So understanding like that close proximity. And so how can we manage that if maybe proper PPE is not available?
So is it, like a proper supply of PPE?
Yes.
So I think that's where the, you know, it's all about a layered prevention approach. So, you know, you not only stay 6 feet apart, you wear your masks, right? 2 layers. So close proximity work can be done with a face mask, face covering, and a shield, so that, you know, and I see a lot of people walking around with the disposable face masks. I like the cloth ones. First of all, they're easier to breathe with. And second of all, I can wear this for a day and then throw it in the laundry and it's perfectly clean. So it is a bit more sustainable, and I have more of a supply. But that layered approach will help with some of the disposable issues and being close. If I had to work, so when I do work closely with patients, and especially if I'm nervous about whether or not they have COVID, we will double layer our facial stuff. So I think that's the best way, is to think about layers of protection, because it's a virus and it's like a filter. You want more and more and more filters before it gets out. Hopefully that helps.
Yeah, and then so we've got a couple of folks who talk about that their allergies get worse with the face mask, or they feel like they do. So any thoughts or ideas around that specifically?
Yeah, so it is a matter of feeling like it, although I'm still trying to figure out why my nose runs. I think it's not really running. I think it's actually the moisture. It's capturing the moisture and it's getting in my nose, so I feel like my nose is running. But yeah, I've had a lot of people say, I feel like I can't breathe. It's not that you can't breathe. It may be increasing the work of breathing, especially with allergies, because your airway is a little bit obstructed, and so you're having to breathe a little bit heavier, which is why it takes a while to learn how to wear these, right? I see some of you have glasses. Nikki, I'm going to pick you out because I see you on my little screen here. You wear glasses, so when you put your mask on and your glasses, they fog up. Gosh, is that annoying, right? So if you just hyperventilate a little bit and just get that equilibrium going, you can clear them up. Yes, you can put the soap on them. That's never worked for me. And all those other things. But it's really a matter of equilibrium. I couldn't think of that word. Equilibrium, right? And getting that balance up. So I would say practice with your mask. If you have allergies, practice with it. Maybe wear it while you're sitting down and not exerting yourself, rather than just putting it on while you're running out into the hallway, because you'll feel it more. And what you will wind up doing is training yourself to breathe better, because this should filter out your allergies, right? Your allergens. So I don't think it's your allergies. I think it's the fact that you probably work a little bit harder at breathing and you just need to train yourself a little bit better. And you can do that. It's easy. It's not hard to do.
Yeah, I love that tip of just putting it on and kind of sitting and being with it, rather than when we're bolting in and out of, the office or into the grocery store, something like that. So we can really train ourselves to get used to wearing the mask, because this is part of what we have to do, and what we'll continue to do moving forward.
It'll also help with your facial stuff. Like if you get little scratchies from the face mask and you wear it a little bit more often, your face actually adjusts to it too.
Wonderful. Let's see, we've got some other things in here. Can employees be required / encouraged to notify their supervisor if they have been tested for COVID-19?
Yeah, so we do encourage people to communicate with their supervisors, and certainly if people are out and it's related to coronavirus, again, I think it's a matter of, sure, it's your personal medical information and maybe you don't want people to know about it, but telling your supervisor in a bit of confidentiality, I think will help that supervisor make decisions about the office. I get a lot of requests from supervisors asking, how do I handle it when somebody tells me they're positive? And I'm like, you handle it the way you handle any other disease. You just, you know, again, be kind and use good propriety. And they've also intervened to help with some of the rumor mill and gossip that goes on. So I think it's, I would work with your supervisor. Hopefully you have the right relationship with your supervisor. You can tell them something like that, and they can help work with you. And maybe if you feel well enough and you want to continue and do some work at home, they can work with you on a work plan so that you're not burning up all sick time.
Yeah, absolutely right. Got some other comments here about just mental health, and I know you hit that note about mental health and just really prioritizing taking care of ourselves in this way right now, because it is going to be a very long haul, a marathon, if you will, to get us to the other side of this thing. So Marn says, you know, by contacting friends, family, coworkers, neighbors, all of those things have been helpful. And then I'll be sure to link you all to HR Benefits website on ways that you can get connected with the FASAP program to make sure that you have a space to process this, because as we talked about, there's a lot of emotion, there's a lot of feelings and worries, concerns, doubts that come along with this. So I'll be sure to link you all to that when we wrap up today. And then I love that you all are adding other resources and things that we can take notes of and be able to share out with the group following today's session. We've got another question. Is the university providing free masks to staff? If yes, where can we pick them up?
So yes, they are. And there are ways to order them. I don't know them, but EMMC, it should be on the Protect the Pack website. There you go. Thank you. Yeah, of course, that's where everything is. It's on the Protect the Pack website. There's a way to order them and get them, and they are supplying masks. Yes, and and also hand sanitizer, which is, I will tell you, very liquidy. In fact, the first time I used it, it was like water. But they have that, and some of the departments are also supplying like little cleaning stuff, not disinfectant, but cleaning, which is good. Yeah.
Yep, absolutely. And I'm with you, Dr. Casani. My go-to is Protect the Pack website. That is our go-to.
And Kim also reminded that all the faculty received their little kits. I have mine sitting behind my desk here, buried under some stuff. Got a little kit for the classroom. Yeah.
Yes, absolutely right. Do we have any resources about do's and don'ts, or what faculty can say to students or staff when working in a shared facility? What we can say to students and users of the facility? Received a PDF from their supervisor of do's and don'ts, but don't know if there's anything else. Is there anything else out there that you know of?
Yeah, there are some resources. There's a new video, and I don't know the link, but I'm sure it's on the Protect the Pack website. There's a new video out about how to approach people who aren't wearing masks and how to do it kindly, and then, you know, how to amp it up a little bit if you have to. Certainly not confrontationally. And again, I think, you know, saying, you know, I would feel better if you wore your mask. Is that okay? You know, and if they say no, you say, okay, well, I'm going to step back then. and, you know, the implication is this conversation may be a little bit more difficult if I do, you know, and just voice your concern. But again, in a kind way. There may be other reasons. I think one of the things that I learned through all of this was that the issue of people who are uncomfortable wearing masks, not for medical reasons, but for some of the social reasons. Either they have been a victim of a crime or abuse, and so if someone approaches them who has a mask on, that's very anxiety provoking. If they wear a mask, it's anxiety provoking. Some of the Black students have talked about how they feel they're going to be perceived if they wear a mask, especially the Black men on campus, how people might perceive them. That sort of subconscious perception. So there's been a lot of that conversation. I think it's a really healthy conversation. And so there may be other reasons why people aren't wearing face coverings. So again, be kind, you know, be human. And it's really hard sometimes if you're nervous and anxious, it might come across wrong. But I think if we just work at that.
Yeah, absolutely right. And I'll be sure to link you all to the Ombuds office did a PDF on how you can talk with people about face coverings and practicing physical distancing. So I'll link you all to that, as well as I found the link for that video. So I'll be sure to include that as well. But I love that sentiment of just being kind and being human and recognizing that, yes, we all have really strong feelings about the need to wear a mask one way or the other. And that comes from a lot of different places. So the more that we can extend that kindness to each other, we might find some common ground and realize that, like, you have anxieties and so do I. And hopefully we can do our part to continue protecting the pack as best as we can. So let's see.
So Alexis, while you're looking, there's a question about the safety of reusing paper masks. Yes. So the masks that you're getting are non-woven, they're not paper. So they can be cleaned. And again, they come with a little instruction thing on how to clean them. Paper, or the more papery kinds of procedure masks, like surgical masks, they are not to be recleaned. And if you wash them, they'll fall apart. So that shouldn't happen. That's why I really like the fabric little face coverings. And there's quite an industry on campus. I want you to know, everybody I know who sews, including me, is making a gazillion of these. So if you have some good friends, hopefully they'll make them cheaper. I will tell you, in case you don't know, if you're not a sewer, getting any kind of university imprinted fabric like this is $18 a half a yard. Like, they are making money hand over fist on this fabric. I bought LSU fabric for $14 for a half a yard. That's outrageous. So I will tell you that if they say, yeah, I'll make it for you, but I need to charge you $5, don't feel bad. Yeah, because it costs them a lot of money. And Alan put up, I sell masks. Yeah, good. Seriously, I mean, reach out. Some of them are really cute. So they're becoming the new fashion statement, right?
Yes, exactly. A way of expressing yourself.
Yeah, hopefully we're all expressing ourselves the right way.
Yeah, exactly right, the right way. Someone says, I may have missed this because I joined late, so I apologize if it's been mentioned. Are we allowed to take users of the facility's temperatures? So is that something that is permitted, or is that based on facility and departmental specifics?
I'm sorry, say the question again.
So are we allowed to take temperatures of the users of facilities?
Yeah, we're not going to say you're not allowed to do them, but we're not going to encourage them. And I know that some departments have tried to purchase the thermometers, and there have been very, 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 very small areas where we've allowed university purchasing, or not we, it has been allowed for university purchasing of thermometers. So again, because they give you wrong information. I only like to collect information that's useful.
I think that's a really nice reminder to us, as well as folks who maybe don't have as much in-depth knowledge that you do, that data that we collect. We don't want to just, like you mentioned, the questionnaires have piles and piles and piles and piles of data daily that we're not doing anything with. So that's a good way of us kind of managing our expectations as we move about campus.
Well, and it's easy to have those expectations when you see, like, the Amazon commercial on TV, not to name a brand, but where they're doing all this check-in stuff. But if you see what's happening is when they get into the warehouse, they are working very close together. And so they felt that the risk of false information, okay, limited false information, was worth it, because they cannot control in every way, size, shape, or form what's happening in the warehouse, right? There's also subpopulations that are particularly devastated by this infection, and because of other jobs and other responsibilities. So there are subpopulations that, so we saw a number of infections in some of our subcontractors during construction over the summer, and that's because they go from job site to job site to job site to job site. So they're always interacting with a whole bunch of people that they can't stay away from. and then they go home to their communities, and the same thing is happening in their communities where the transmission rate is high to begin with, and so there's all this interaction. So of course they have a higher infection rate, and so some populations are particularly prone, and then are particularly prone to serious infections should they get it. So it's pretty tough.
Absolutely right.
Yeah.
All righty, team. So we are approaching the 1:30 mark, so I want to be mindful of everybody's time. I know that we love to get to come together and do this, and I know that we all have work that we need to hop back to. So what I'll do is I will save all of the chat that we've had today and take away those high points, things that we want to keep in mind, all of that good stuff. We're seeing a lot of comments coming to me that are saying a huge thank you to Dr. Casani for being on the call today, for answering our questions, and just having a candid conversation about how we can take care of ourselves and others, and kind of manage our own expectations as we make our way back to campus or not. And so what I'll do is I'll send all of this good stuff out to you all. You have my email address for any questions that you might have following this. I do want to say a quick note before we start heading off that we have our Fall 2020 lineup available for registering now. So we have a lot of really interesting talks that are coming to us for the fall semester, and each of the Power Lunches now have their own registration button. So if you want to go ahead and register in advance, add it to your Zoom. That's something new that we're trying this time around. That way you can already have it on your calendar. You can have the lineup for the semester there. And then I'll link you all to that page where you can find more of that information for the coming months. And then the last thing that I'll also highlight is that we have a new mindfulness challenge that we have initiated now, and our registration is up and ready. So I'll drop the link in the chat here. So if you want to take just 3 minutes a day for the next 7 days, starting August 24th through the 30th, that is a great way of extending that kindness to yourself, extending that kindness to others, and taking a moment to check in on your mental health, because we all know that we're going to need some TLC with that. So that's our way of providing a little bit of mindfulness to you, to your inbox for 7 days in August. So I hope you all will sign up and register for that. And we've got one more person that has raised their hand. Is there anything else that you would like to say, Maureen?
Yeah, Dr. Casani, I want to ask your help in considering a common procedure be developed for people who have to work close. Because facilities, I've gone down through the procedures. I've been here 20 years. Mm-hmm. I worked in 2 hospitals for like 3 years. So I understand your background. My dad's a doc. My sister's in a COVID-loaded central facility in Denver, Colorado, and I talked to her. She's on our old university's advisory board for pharmacy board. So she and I talk daily, almost, about. So I would like to emphasize my wish for you to help get the idea across that in certain cases we say, oh, it's $50, or it's pick a number of stuff, and we build a kit and we say, well, you got to go in to do this stuff for a while, grab this style kit and you go do it, and then you're done for that task for that day. I think that I've been on campus. I did counsel the young student employees yesterday in a nice way. I pay attention to their needs. But you know, they're touching their face, and then they're handling stuff. I guided them to ways to help them. But in the bigger picture, the university's got 10,000 employees. A number of us have to manipulate physical entities, not all virtual. So the idea of being able to come up with a common procedure that facilities can use, that the IT people can use, that whoever has to touch a thing you can't get away from because you got to be close enough to do the dang job, is something I really want to bring to your attention and thoughts. Thank you very much for listening to my hammering this one home with, yeah, I do have a railroad spike around here someplace. Okay, my grandfather
fine.
was a blacksmith.
It's fine, thank you. We've talked about it at times. I don't think we ever got there, so good, we'll bring it back up. Thank you.
Yeah, facilities is a perfect example of, okay, you got to do it. How are you going to do it? When you get in with motors that you have to bring up with chain hoists, because I've watched them do it. Then how do you get close enough to actuate the physical reality so you can do stuff? I've got to bring the UPSs and servers up that were not designed in wonderful server rooms of, I've seen the pretty pictures of the beautiful places where you spend billions.
Yeah.
We don't have those. Not everywhere.
Yeah. Okay, good. Thanks.
Thank you so much.
Absolutely. Well, thank you all so much again for joining us. Again, check out the Pack Pause Mindfulness Challenge as a way for us to take care of ourselves and our minds during this time. I'll be sure to link you all to the fall 2020 lineup. Again, everything will be virtual, so we'll be on Zoom doing the virtual thing again. If you all have any questions, you have my email. Reach out to me. I'll be sure to share out Dr. Casani's slides and then any additional resources that you all shared in the chat and that I have, Dr. Casani has. All together, we'll do our part. And I want to thank you, and I hope you have a great day, okay?
Bye, everybody. Thank you.
Yeah, take care.
Bye.